Okay, welcome back to our fourth session of this PowerPoint. I know it's long, and I'm hoping that breaking it up into segments will help you be able to take small bits at a time. Like a dentist that I used to know would always say, how do you eat an elephant? One piece at a time. So let's just take this oral pathology one at a time. So we're going to pick up where we left off with inflammation. So what is inflammation? Inflammation is a protective response to an injury or an irritation. So even though it seems like it's a bad thing, actually it can be a good thing because it lets us know that there is an injury. So how do we recognize that inflammation? Typically it will be red, or maybe a little brighter pink, maybe some warmth, like a little bit of a fever or temperature to it, and it can be painful at times. So our body is letting us know that there's an irritant there, whether it be on the body or in the mouth. So inflammation, we have to be able to recognize that. So we have two different types of inflammation. Of course, it's acute and chronic, and I bet you're already familiar with those terminologies. So looking at acute, the injury is short and minimal. That would be maybe like again, referring back to maybe damaging your tissue with maybe toothbrush abrasion, or maybe something you had eaten hard. Healing can begin to repair tissues rapidly, and luckily in the mouth the tissues do heal very quickly. Then you have chronic inflammation. The injury is continuous. So I always think of something like maybe a partial or a denture that rubs against the mucosa or the gingival ridge every day. So that would be inflammation that could be continuous from being a chronic irritant. Healing cannot occur until the source is removed. So think about, again, the partial, the denture. You'd have to take that off and remove it, or either have it adjusted by the dentist. As I was saying, the denture would have to be removed in order to take the source away for the healing to take place. People that bite their cheeks, they need to not do that, because that is a chronic inflammation, a chronic irritation. So that could be something that, in order for the cheek to heal, the tissue to heal, they would need to discontinue that habit. Okay, looking at lesions that extend below the surface. Let's look at a couple of this terminology. We have ulcer, erosion, abscess, and then we have cyst. So let's look at the ulcer. I'm sure everyone has either have experienced or know someone that may have had a mouth ulcer. So it's a defect or a break in the mucosa that results in a punched out area similar to a crater. So in other words, it extends below the surface and kind of dipped out. So it's a break in the tissue. Erosion is the soft tissue can have a shallow defect in the mucosa caused by mechanical trauma. So erosion, we like to think sometimes that could go back to biting the tissue. Abscess, a localized collection of pus in a circumscribed area. So that could be either a perio abscess or a tooth abscess. You could also have a soft tissue abscess of a type. So then you would have a sac, or a pouch that's lined with epithelium and contains fluid or semi-solid material. We refer back to that as a cyst. So the dentist a lot of times can palpate these areas and tell whether it is a cyst, an abscess, because of either the feeling of it. Either it could be hard, or it could be soft and kind of where you could squeeze it. So sometimes they can make some determination or diagnosis by adding palpation to their exam. Okay, let's look at lesions extending above the surface. So I'm sure you've all heard of blisters before. That is a vesicle filled with a watery fluid. So we think of a fever blister. I'm sure if you've ever been sunburned, maybe you had a blister from the sun, and it would extend upward above the tissue and would have fluid in it, and then it has to sort of go through a process and heal and rupture, and then you typically will heal from there. A pustule is similar in appearance to a blister, but it contains pus, which is basically dead tissue and irritant and fluid that has gathered and somewhat become infected. A hematoma is something that I'm sure everyone has heard of before. We typically call it a bruise. So a hematoma is similar to a blister but contains blood. So as the watery fluid is in the blister, you have pus in the pustule, and then you have blood in the hematoma. That's what gives its discoloration. You have something called plaque. Now this plaque is different than what we're talking about, plaque on teeth. This is totally different than that type of plaque. This is plaque that's found on the tissue. It's a patch or a flat area that is slightly raised from the surface, because remember, these are extending above the surface. So when I think about a plaque in this regards, I think about an area inside the cheek, maybe where someone holds tobacco, something like that. So that would be a raised area from the surface, and usually it's in a patchy area. So those are lesions that extend above and below, and you will need to know that for testing these different lesions. Are they below the surface or above the surface? Okay, so that ends that session of it before we move to diseases of the soft tissue, but I'm just going to continue on here because I have time in this recording. So let's look at diseases of the soft tissues. The first one we're going to look at is called leukoplakia, and leukoplakia simply means a white patch. These are lesions, but still, again, it's an oral disease. Lesions that vary in appearance and texture from a fine white transparency to a heavy, thick, warty plaque. Now there's our word again, plaque, that I was talking about in the other slide, that is like a raised area that extends from the tissue. So this could be white, and typically it is. It has a transparency to it. It can be heavy and thick and warty in the appearance. Usually the dentist can identify leukoplakia fairly easily. It's firmly attached to the mucosa, so you cannot wipe it off. It will not go away when you wipe on it. It is attached. Usually not painful, so the patient usually doesn't even notice it or complain about it or anything. But we do typically have to do a biopsy to be sure it's leukoplakia. 9 times out of 10 the dentist can tell, but we never want to miss that opportunity to make sure. So a biopsy of an area that has leukoplakia on it is always recommended. So again, leukoplakia. Okay. All right, so let's continue on with leukoplakia. The cause is unknown, but leukoplakia is commonly linked to chronic irritation or trauma. So again, we go back to our irritation or our inflammation being chronic. So there's something irritating this tissue, or it is traumatizing it. So again, we go back to ill-fitting dentures. So dentures that do not fit well. I don't know if you recall or not, but earlier in the fall when we studied removable prostheses, some people think, well, if I have the teeth removed and make a denture, that's the only denture I'll ever have to have made. Well, that's not true, because the tissues are always changing. So a denture really needs to be either remade or relined within about 5 years, because the tissues change so rapidly. So if you have a denture that's 10, 15, 20 years old or older, it just sits on the tissue and it's irritating because it no longer fits. So that can be an irritant. Cheek biting is another one, often linked to tobacco use. A lot of times leukoplakia is. So again, holding, chewing tobacco, snuff, things like that in the cheek or in the inside of the vestibule of the lip, often with tobacco. Leukoplakia very often precedes the development of a malignant tumor. So leukoplakia is very important that it be diagnosed. Now, what we run into is that people that use the tobacco will have this area on the tissue, and they really need to stop it. So they need to take it away and let it heal. If it continues to be there, it has been known to be a high risk to that plaque area, that warty patch area turning into a malignancy, so the tissue then would become cancerous. So leukoplakia. Now here is an example of leukoplakia. This is typically what we see with a tobacco user that is holding snuff or chewing tobacco between the teeth and the lips, sometimes even on up higher into the cheek area. So if you notice, it has a white appearance. It looks rough, sort of warty looking. You can try to wipe it off. Take a 2x2 gauze and wipe it off. It does not remove. It is kind of a rough area. So this is an example of leukoplakia. If you look here in the teeth, I would assume that's some type of chewing tobacco. It will also cause these teeth to decay because there's sugar in chewing tobaccos. Okay, so again, this is an example of leukoplakia. Okay. Here we have an example of leukoplakia on the hard palate of someone that's edentulous. They've removed the denture, and again, we talked about how, the irritant is there. So this leukoplakia can grow up under removable prostheses. So this is a very large area of leukoplakia. And again, notice the appearance, kind of rough, warty looking. Looks like if you could feel it, it would feel kind of rough. Okay, leukoplakia. Okay, let's move on to our next one. It's called lichen planus. It's a benign, which again means not cancerous. This benign chronic disease affects the skin and the oral mucosa. Many factors have been implicated to lichen planus. However, the cause remains unknown. Unlike leukoplakia, lichen planus, we really don't know what causes it. But it's usually patchy again. White lesions of the oral mucosa have a characteristic pattern of circles and interconnecting lines. So this pattern is called the Wickham striate. So circles and interconnecting lines going through it. It looks different than leukoplakia. Okay, so here's an example of lichen planus on a buccal mucosa. If you notice, it does not look warty looking. It does not look that extensive. It does not look rough, but you can see the circles. And then you see the lines, how they intersect and go around. They extend out from it. So this is a good example of lichen planus. Remember, typically it is benign. Okay, another example of lichen planus. This is just a close-up shot of the cheek. Again, you see the circles, and you see circles here. They're can be odd shaped, but the lines intersect, cross over each other. So again, it's very defined as lichen planus, different than leukoplakia. All right, so let's move on to our third one called candidiasis. Candidiasis is a superficial infection caused by yeast fungus called Candida albicans. We talked about that, I believe, in the first recording a little bit. So candidiasis occurs under conditions such as antibiotic therapy, diabetes, xerostomia or dry mouth, and a weakened immune system. It can be the initial clinical manifestation for patients with acquired immunodeficiency syndrome or AIDS. Again, don't jump to conclusions that a person has AIDS because they have candidiasis. It is very common to a lot of other things before the HIV, particularly antibiotic therapy. We see it a lot with that because it's a yeast infection. Diabetes, we see it with a diabetic fairly often, somebody with a dry mouth, which, the flow of saliva there is not well. Okay, it's also related to common types would be diaper rash, vaginitis, and a lot of people call it thrush. This is an older terminology, thrush. So I'm going to have to stop here and pick back up in our next recording because I'm running out of time. But we'll get the next session going in just a few minutes, and I'll get those posted.